Assalamu alaikum and good day. In this lecture, we are going to look at neoplasia. This lecture and video is divided into 6 parts. In the first part, we are look into the terminology. The second part, we are going to look into benign and malignant neoplasia. In the third part, we're going to look at pre-malignant condition. The fourth part, cancer incidence, spread and effect in the fifth part, and prevention and tumor marker in the last part. Remember the term tumor in the cardinal signs of inflammation? Tumor is a general term used for describing pathologic disturbance of growth characterized by excessive and unnecessary proliferation of cells. Galland described a tumor as swelling according to nature, such as in pregnancy, swelling exceeding nature, such as a callus, as seen in the picture, and swelling contrary to nature. Some pathologists divide tumor as neoplasia and some tumor-like conditions. So under neoplasia, we will learn about benign neoplasia, intermediate neoplasia, and malignant neoplasia. Tumor-like conditions are conditions such as choristoma and hamartoma. The word neoplasia means new growth. The best description of neoplasia is from the Professor of Pathology, Professor Willis from University of Leeds in 1953, who described neoplasia as an abnormal mass of tissue characterized by growth that exceeds that of normal tissue, is uncoordinated with that of normal tissue, and persists after cessation of the inducing stimuli. Now we apply the definition to this example of lung neoplasm. The neoplasm grew after the patient has been exposed to risk factors such as cigarette smoking. The neoplasm grows exceeding that of the normal tissue. It is uncoordinated and the growth persists even after the patient has stopped smoking, which is the inducing stimuli. Neoplasms can be divided into 3 categories based upon their behavior. A benign neoplasm does not invade or metastasize. A malignant neoplasm can invade and often metastasize to other parts of the body. A borderline neoplasm is a neoplasm that we cannot predict the behavior with certainty. Nomenclature is a system of names or terms. Neoplasm has their own nomenclature that can distinguish a benign neoplasm from a malignant neoplasm. For example, for benign neoplasm, the suffix "oma" is usually added to the cell type. If it's from the connective tissue or mesenchymal in origin, a benign cartilage neoplasm is called chondroma. A bone neoplasm is called osteoma. A benign adipose tissue neoplasm is called lipoma. If it's from the epithelium, it can be called an adenoma. If it is derived from more than one germ cell, it is called a teratoma, usually containing tissue from the mesoderm, endoderm, and the ectoderm. For malignant tumors, the nomenclature for mesenchymal malignancy is called a sarcoma. If it is a cartilage malignant tumor, it is called chondrosarcoma. If it's derived from the bone, it's osteosarcoma. If it's from the adipose tissue, it's liposarcoma. If it's derived from the epithelium, it is called a carcinoma. And if the epithelium is gland forming, it is called adenocarcinoma. If it is squamous forming, it is squamous cell carcinoma, and if it is from the urothelial or transitional cell, it is called transitional cell carcinoma. Now we look at tumor-like conditions. The first one is hamartoma, which is defined as excessive but focal overgrowth of disorganized cells and tissues native to the organ in which it occurs. Examples are hamartoma of lung angiomas, and pigmented nevi. The next one is choristoma, also known as heterotopia. It is defined as normal cells or tissues that are present in abnormal locations. Examples of these are pancreatic cells in the wall of stomach or intestine, or nests of adrenal cells in kidney, lung, or ovaries. We look at the example of hamartoma in this cherry angioma. In the normal skin, you have the blood vessels, the epithelium, the dermis layer, but in this case, there is focal overgrowth of blood vessels that is disorganized, and the blood vessels is actually native to that organ in which it occurs. It is called hamartoma because of that. Now we look at the example of choristoma or heterotopia. In this case, we have the pancreatic cells in the wall of gallbladder. Normal pancreatic cells only is seen in the pancreas. However, in this case, it is present in the gallbladder, which is an abnormal location.